The total active cases with those I've announced today is now 1,180, 1,176 locally acquired, and 4 which are overseas acquired. Yesterday, or that is to say overnight, we received 48,572 test results. That's a fantastic effort. Again, we thank all of those people who've gone and got tested, and we thank particularly those who, prompted by symptoms, have wasted no time at all and gone and got tested really fast. That is incredibly important. Of that 48,500 tests, around 6,000 of those are Shepparton tests, day 13 tests, and that's a significant thing to have got through a big chunk of those day 13 tests, given the sheer numbers of people who have been isolated away as close contacts as part of the Shepparton outbreak. I thank those people for coming forward. I thank them for the contribution they've made to keeping all of us safe by being locked in 24/7 in their homes. We thank them very, very much, and the response of the people of the Golden Valley, yet again, just quite an amazing effort, and we're deeply grateful and so impressed and so proud of all that you have achieved. There will still be some people who at day 13 test positive and will have to be in for another 14 days. There'll be others who become close contacts that'll have to make that sort of sacrifice as we look to the weeks and the months ahead, and in anticipation in that community and in all communities. We thank people for the work that they do. It is such an important part of our response to this virus. In terms of vaccines, there were 33,511 vaccines administered in our clinics yesterday. That's 2.517 million doses that have been administered in total through state-run centres, with more than 5 million doses across the state from all sources. That's very impressive. This is really ramping up, and that's such an important part of how we chase down that 80% double dose target. That is central to the delivery of the national plan. We're now more than halfway, well and truly more than halfway, toward Victoria's target of 1 million doses over a 5-week period. I can report that we're now at 589,282 doses. So we will, I think, not only meet the 1 million in 5 weeks, we're on track to, in fact, beat that target and get there a little bit earlier than we had planned. That's fantastic news. There's a lot written and a lot said about vaccine hesitancy. That's not the experience that we've had to this point. People want to come forward and get their vaccine. Indeed, in some respects, more than we have vaccines available. However, that is easily remedied, and I'll come to that in just a moment. We are still obviously a number of days away from being at that milestone we talked about the other day of 70% single dose. We're still a number of days away from that, but every vaccine that's administered today and every person who makes an appointment with a sense of urgency brings the day that we get to 70% first dose, it brings it closer. So the more people we vaccinate faster, the quicker we'll get to 70% first dose, and the quicker we'll be able to make those, that is to say, deliver on those announcements we made the other day. So the quicker we get to 70%, the more vaccinations there are undertaken, then we'll be able to make those changes that we announced the other day, perhaps earlier. And of course, there's other work going on to try and add to that list, noting that it was a modest list, because that's what was considered safe by the Chief Health Officer. But there may be some other things I've mentioned, outdoor recreational activity, things of that nature. Potentially some other industry settings. Again, it will need to be modest because of the situation we're in, but we will have more options once we reach that 70% first dose. The more people who get vaccinated, the quicker we'll get to that marker. That is the point that I'm making. In terms of AstraZeneca and any sense that, look, you can wait, you can get vaccinated in 6 or 8 weeks or in a couple of months' time, whatever it might be, the best vaccine is the one that's available today. AstraZeneca is available today. We spoke earlier in the week about the fact that there were 72,000 appointments that were unfilled. I'm pleased to say that number is now down to around 50,000. In fact, just on one day, no doubt linked to the fact that we had bought the, on expert advice, the AstraZeneca interval from 12 weeks to 6 weeks for the second dose, we had 14,170 AstraZeneca bookings made on a single day. That is very significant. I just wanted to give you an age breakdown of those bookings. 18 to 29, 5,707. 30 to 39, 5,082. 40 to 49, smaller numbers, only 298. About 500 in the 50 to 59 age bracket. Just under 2,000 in 60 to 69, and some 620 bookings in 70 plus. Put it another way, on that single day, one of our biggest ever single days of bookings for AstraZeneca, 3 in 4 of those bookings was for someone under 40. This is a choice that's being made by hundreds and hundreds of thousands of Victorians. We've already got 2.6 million AstraZeneca doses into arms, our clinics and others. And what that means is that literally millions of Victorians will be double dose vaccinated with AstraZeneca. It's safe, it works, it is available right now, and that means for many, subject to a conversation with a doctor or a pharmacist or a senior nurse vaccinator who we will provide to you at a state clinic, it is the best vaccine. It is the best vaccine for you. In terms of one further point on AstraZeneca, I would note that the Prime Minister, I think yesterday, wrote to all over 60s across the country and made the point that the next cohorts of people that will become eligible, next groups of people that will become eligible for Pfizer, will be younger kids in that 12 to 15 age group that are currently, they're approved but they're not yet eligible. People over 60 who are already eligible for a vaccine, the AstraZeneca vaccine, the Prime Minister's made clear that they will go into the queue behind those who are eligible and can only receive Pfizer. So I suppose the message I'm sending today is talk to your GP or make a booking at a state clinic and come and talk to a health professional when your booking comes up. Turn up and have that important discussion. That's available right now. Don't get in the queue if you're over 60. Don't get in a queue that's right down to 12-year-olds. That's going to be a very long wait, and we don't have time to wait. We need to get as many doses into as many arms as possible. Victorians have done an amazing job in terms of AstraZeneca take-up. Every time I speak to the Prime Minister, he notes just how much success we've had with AstraZeneca, and he also makes those comments publicly. Don't get in a queue with millions of other people. Go and get vaccinated, book an appointment today, and as I stand here, there's 50,000 appointments available over the next 3 weeks. Go online, book one of those appointments, and then, of course, when you turn up, have that conversation, make an informed choice, and hopefully get the vaccine that is available right now. That is such an important part of our campaign and our struggle, all of us, against this virus in this global pandemic. Now, I don't so much have announcements to make today, but I did want to highlight some work that's going on at the moment very quickly. First of all, we are expanding and we will train up a bigger and broader health workforce to administer vaccines. It's essentially everybody who can do this safely needs to be part of that team as we grow and expand the total amount of vaccinations that we do. With expanded hours, with many more appointments being offered over time. Again, a lot of this is subject to supply, and just as I was coming into this meeting, it seems that the Prime Minister will have some very important news quite soon, it seems, in relation to additional vaccine supplies. I'll let him make those announcements, but if what's reported pans out, that's fantastic news for all of us. So we are going to move to including dentists, oral health therapists, pharmacists, podiatrists, that's hospital pharmacists, podiatrists, nursing and midwifery workforce, paramedical students. The student involvement is really important. Those who are partway through their studies but are not yet fully qualified, they have and can be trained up to have the requisite skills to be part of this workforce. We don't want a situation where the number of people to administer the shot is a limiting factor. We don't think it will be. So these are just logical, common sense changes, and I think they will serve us very well. In terms of final year school student blitz, so that year 12 vaccination blitz that we announced earlier on in the week, that priority program begins from next Tuesday, the 7th of September, and runs until the 17th of September, that Friday. This is all about making sure our senior students who are sitting those year 12 exams have certainty and have at least one dose as they head into that exam period. There'll also be a number of teaching staff and examiners and people who supervise that activity who will need to be vaccinated and will be part of that process. Schools will reach out to year 12 students and indeed year 11 sitting year 12 exams, so doing year 12 subjects. The best way to do this is not so much from the centre, but to have that local specialised that important communication at a local level, and that's how this will work. Schools will reach out to their senior students and have that discussion about making bookings and about getting through as part of that blitz. They will have priority access to appointments, and they will have priority treatment when they turn up at a state clinic. Those bookings, those appointments, will be able to be made from Monday the 6th of September. We think it'll be around 50,000 priority appointments that we will need to have booked and then processed, and we're very confident that we'll be able to do that. It's not just at the 55 current state clinics across the state. There'll also be a number of hubs that will pop up, as it were. Just to give you a couple of examples, Gladstone Park Secondary College and Roxburgh College in Hume, Point Cook, Tarneet and Werribee Secondary Colleges in Wyndham, Lakeview Senior College in Melton, and Dandenong High School in the greater Dandenong area. This is about bolstering our current vaccination network and making sure that we've got extra points, as the Commonwealth call them, points of presence, where people can go and get their vaccination as a priority group.